My name is Tony Khoury. I'm the head of pediatric urology here at CHOC Children's, and I'm a professor of urology and head of pediatric urology at the University of California in Irvine. Today we're going to talk about bladder exstrophy. Bladder exstrophy is a very rare condition that affects approximately 1 in 50,000 children born with a large defect of the lower abdominal wall. Bladder exstrophy is considered sometimes a defect of the bladder, but in reality it's more than that. It's a defect of the abdominal muscles, the pelvic bones, the bladder wall, and the skin overlying the lower abdomen. Bladder exstrophy is a formidable defect, and it is fairly shocking for the families when the child is born, especially if it wasn't recognized in the prenatal ultrasounds. Because of that, we tend to repair the defect very early in life. Our best results are when we are able to repair this in the first 2 to 3 days after the child is born. And the way the reconstruction happens is we reconstruct not just the bladder, but the pelvic bones, the abdominal wall muscles, the bladder, and in the case of boys, we also repair their penis at the same time. And by doing that, we hope that the bladder will start functioning and we'll have some cycling of urine through the bladder, which will allow the bladder to begin to form in a more normal fashion and develop as an intact organ, leading to adequate storage later in life and hopefully good continence for the child. The long-term consequence and follow-up for bladder exstrophy really depends on how well the first operation was performed and the nature of the bladder plate, the exstrophic or the outside bladder plate. If we have a favorable plate and the initial procedure was done well, many of these children can go on to normal bladder function. However, if the plate was very small or the first operation was not done well, then only a minority of these children go on to have a normal bladder function as they get older.